eSNORE and sleep, the modern way to diagnose and treat sleep. Snoring and sleep apnea, diagnosis and treatment. Snoring may not only be disturbing to your bed partner, it may be a sign of a serious health condition called sleep apnea. Sleep apnea occurs when the tissues in the airway repeatedly collapse, causing the person to stop breathing. Side effects include daytime sleepiness, dozing while driving, trouble concentrating, desire to nap, and can lead to heart disease and stroke. A simple 3-sensor home sleep test can provide all the information needed to diagnose sleep apnea. This illustration demonstrates the data results from a home sleep test. A chest band measures breathing effort, which corresponds to waveform data. A pulse oximeter is worn on the finger, which measures heart rate and oxygen levels. During normal sleep, the body typically rests with a heart rate below 60 beats per minute and oxygen levels at or above 95%. After falling asleep, the tissues in the back of the throat relax, sometimes causing snoring sounds. As snoring occurs, airflow pressure reduces. That reduction is visible on the top waveform data of the study. When apnea occurs in our diagram, you can see the uvula and back of the tongue collapse completely in the airway. This is known as obstructive sleep apnea, or OSA. The waveform data on the top of our graph will flatline as airflow ceases. During and after obstructions, blood oxygen can drop to abnormal levels below 90%. The lack of air and oxygen cause the heart rate to become erratic. Apneas like this can occur dozens of times an hour. Instead of a restful 60 beats per minute, heart rates can rise above 80. It's easy to understand why people with sleep apnea suffer from daytime sleepiness and are more likely to have heart disease and stroke. Auto CPAP therapy. Auto CPAP is an abbreviation for automatically adjusting continuous positive airway pressure. It generates room air which is channeled through a mask interface worn while sleeping. When you start the therapy, the auto CPAP begins at a gentle low pressure setting. But as the tissues in the back of the throat relax during sleep, it monitors the airway for obstructive apneas and increases the pressure as needed. This technology has been around since the late 1990s and is an approved alternative instead of overnight manual pressure setting tests performed in hospital labs. Oral appliance therapy. Oral appliance devices are an alternative for those with mild to moderate sleep apnea. They are custom made by dentists trained in sleep medicine. They work by slightly advancing the lower jaw so that even when the tissues in the airway relax, they do not cause snoring or obstructive apneas. Most units can be adjusted for comfort and effectiveness and are constructed to last several years. A simple 3-step all-in-one package that will diagnose and treat your snoring and sleep apnea. Step 1. Home sleep testing. Just take a few minutes to answer questions over the phone or online. There's no need for waiting rooms or doctor office visits. A healthcare professional will decide if a home sleep test is right for you, and we will provide you with the most comfortable, accurate home sleep test available. There is no need to travel from home or inconvenience yourself with overnight stays in hospital beds. Many facility lab tests require wires affixed to the face, scalp, and limbs. This is because they test for leg movement, REM, and other disorders. But since we only test for sleep apnea, there is no need for intimidating, elaborate sensors known to make it difficult to fall asleep. Our home sleep test system uses 3 sensors that can diagnose obstructive, central, and mixed apneas. There's a chest strap which measures breathing effort, a second sensor which measures airflow, and a non-invasive pulse oximeter which measures both heart rate and oxygen levels. Just press one button to begin the test. You will be notified if a sensor is not connected properly. Then go to sleep as you normally would. You can relax in the comfort of your own bed without the anxiety which sometimes occurs during an attended lab study. Step 2. Review test results. Within a few days, you will have a one-on-one phone consultation with a board-certified physician. Again, no need for waiting rooms or office visits. The doctor will review your sleep test results, treatment options, and can even prescribe auto CPAP therapy. Step 3. Begin your therapy. eSNORE Sleep will forward your prescription to an affiliate community CPAP provider. You can learn about the use and maintenance of your CPAP device and try the current mask interface brands including nasal pillow, and full face. You can even receive equipment and training at your home. Our providers will be there to exchange products or make adjustments to keep you compliant and happy with your therapy. If you test negative or have mild to moderate sleep apnea, we can refer you to have an oral appliance created by one of our American Academy of Dental Sleep Medicine dentists. They will review the different manufacturer brands, take an impression for a custom device, provide a home test to verify effectiveness, and make adjustments when necessary. Surgical treatments may also be an option for some patients. We appreciate you taking the time to watch this video. To find out more, please visit eSnoreSleep.com or call toll-free 1-844-2-eSNORE.